what I organized to talk about tonight is how my experience as a physical therapist is contrasted with having the Winback since November 2022, doing pelvic floor treatments, probably a good 2/3 of my day, and spending a lot of time in tight places intrarectally, and how my practice has evolved both in terms of how thorough my treatments have become versus not having the Winback, how the patient experience has improved, and how I feel like longevity of my career has been improved by using the device. So I'll just share a little bit about my process in treating a typical chronic pelvic pain patient with the Winback. I'll typically have the patient sideline, and the hand that I'll be using incorrectly, I'll glove up first. Again, this is a great tidbit I learned from the group. Actually, no, put the bracelet on first with the dab of cream. Okay, I always have to think about, wait, bracelet first or glove first, then the glove. And that's important because you don't want any little pinholes in the glove, because that can create a contrast in the energy between what's mostly covered by the glove and that little pinhole area. That can create a hot spot for me as the therapist and for the patient. And so then I liberally apply special Winback gel to my index finger. I'll also have a bracelet without a glove on my external hand, put the Winback gel on my outside hand, and I'll be providing let's say a sacral or even an external coccygeal treatment, while I then insert my gloved hand into the rectum, through a gentle process, patient consent, and various procedures to help the patient feel comfortable. The settings I typically use are RET, dynamic, and I will work up to 40%. So again, just to show, typical RET and RET plus with dynamic setting at 40%. And if anyone has any, comment on that, I would love to try, a different procedure as well, because I'm learning so much from this group. So again, without the Winback, I would be spending a good part of my day trying to reach as far in as possible and spending, perhaps, up to hours per day with my hand like this, trying to produce enough force to create a change in the patient's tissues. Now, the force of my hand and arm is, I would say, a secondary factor. I don't have to provide a great deal of force to change the patient's tissues. I am considering my role as a conduit of the RET treatment through my hand positioning and through the proper positioning of the patient. And what the patient experiences is that, again, my hand is more relaxed, so they're more relaxed. I can hold, because of the dynamic setting, as opposed to non-dynamic, I can hold my hand on the tissue for longer without the tissue getting too hot. If I am making several different passes all around the pelvic bowl, let's say staying at each location for 2 minutes, okay, all the way around, as I'm making different passes, each pass is easier than the one before. And I'm checking in with the patient the whole time to ask them, hey, are you feeling like things are getting smoother? And just to bring it down to the basic facts of what I'm feeling, I'm trying to feel for smoothing out that rough road in the tissue. If I'm identifying a trigger point, I might stay there, see if it softens. If it doesn't, I'll work directly adjacent to the tissue and a radius around that tissue. You know, perhaps spending a few breaths while the patient's going through some diaphragm breathing techniques, and getting it back to what the other presenters have talked about, using the Winback actively, having the patient do active pelvic floor contractions, and using that diaphragm pistoning motion to provide eccentric lengthening of the tissue while we're providing the treatment. And so, you know, to bring it back to the scheme that I discussed at the start, measuring the pelvic floor resting tone with a Prometheus device, a biofeedback device, I can tell you that their resting tone of my treatments now in the last 10, 11 months, the resting tone is down by 30-40% compared to before I had the Winback, and the patients are able to produce greater peak forces at the end of each treatment, probably somewhere in the range of 20-30% improvement. So that's been a great component to be able to have measurable differences within one treatment. And bringing it back to the time component that the other presenters have talked about, is that if I'm trying to fit in a lot of components between the shockwave and other yoga and pelvic floor treatments in the session, I don't need to set aside 45 or even 30 minutes to make a measurable impact on the patient in these pelvic floor treatments. If I leave, anywhere from 5 to 15 minutes, we can make a significant impact on the patient. So it's been great for having more flexibility in how I can structure the patient session, and what the patient's feeling and what I'm feeling as a therapist. That for me is really my biggest takeaway that I'd like to emphasize, is that the patient is feeling like they're making great improvement within the session. They're feeling really comfortable. They don't have that what I call collateral damage from say trigger point release, where you might disrupt or create some sort of therapeutic damage to the areas around it. And it's a lot less wear and tear on myself as a therapist, and the results are more consistent. And I feel like I have a better sense that the patient is where they are in their treatment cycle, whether they're getting better or not. I know exactly how they're faring by the time they walk out the door.